Midwife parents, this is Brenda, and we are here in Spotsylvania Regional Medical Center, here in one of their labor and delivery rooms. And let me just give you an idea of how big and awesome these rooms are. Here at Spotsylvania Regional, you actually labor and deliver in these rooms, and your family, your partner can be here. You get this awesome bed. Baby immediately goes there and then stays in this cute little bassinet in the room with you. And you get this sweet bathroom too. These rooms are pretty great. So we have several experts we're talking with today. So this is going to be a little bit of a different interview. It's going to be a little longer, and we unfortunately can't take all your questions at once. But if you do have questions, please post them in the comments section below, and we will answer them typing afterwards. So, oh, hey, look who's here. It's
Hi.
Jen.
Hi.
Hey, Jen. Nice magazine.
Thank you.
So, Jen's a nurse here at Spotsy Regional. I've heard that there are some pretty amazing classes here. Can you tell me about that?
There are. We offer several classes here at Spotsy. There's 4 main classes that we offer. We offer a labor basics, which goes through all of the stages of labor, what to expect when you're in labor, how to know if you're in labor. We talk a lot about a lot of the comfort measures and pain management, even medical interventions and things like that that you might see or experience. We also talk a lot about taking care of mom after she has her baby too. We offer a labor express class, which is kind of a more condensed version of all of that stuff. It's just a short one-night class that lets you know kind of what you need to know before you go into labor. We offer a baby basics class, which talks a lot about newborn care, a lot of the basic stuff that you might see or experience with your own baby, and how to take care of your own baby once you leave the hospital too. And then lastly, we offer a breastfeeding basics class, which just talks a lot about how it all works and answers some of the common questions that mamas might have, like how do I know if my baby's getting enough milk, and how often do I need to feed this kid? So we answer all of those questions there. We talk a lot about pumping and things like that too, a lot of the common questions that moms have. So
Cool. So who should come to classes like that?
We offer these classes as a free service to our community.
Oh, so they're free.
They are. There is no fee for them. Anyone
that.
can sign up for them, whether you choose to deliver here with us or elsewhere. We just want to offer it as a service to our moms in the Spotsylvania, Fredericksburg, Stafford communities. While it's free, we still ask that you register for them because there are limited spaces, so we want everyone to be able to have a chance to go. So we ask that you go online to our website, and I think we're going to post the information below shortly.
Absolutely, guys. We're going to post that information in the comment section after this interview. So you definitely need to pre-register so they know how many people are coming. So how often are these classes offered?
We offer most of the classes at least once a month, and then the full labor class, which is actually a 2-night class, we offer once a quarter, so we offer it a couple times a year.
Very cool. Well, thank you for answering my questions.
Thanks, Brenda.
Cool. Well, guys, let me walk you a little bit around the labor. Oh, hi,
Hey,
Jennifer.
Brenda.
Hey, what are you doing here?
I'm just rounding on the patients for lactation.
So you're a lactation consultant.
I am.
So, okay, what is a lactation consultant?
Well, I'm a registered nurse, and I have additional training and credentialing specific to breastfeeding. So I support our breastfeeding moms here in the hospital.
That's awesome. So I actually have a couple questions about breastfeeding for you. See if you can answer them.
Sure.
So I've heard that if you're sick, you should not breastfeed, or that maybe you should quit your medication if you're breastfeeding. Are those true?
No, that's a myth.
Okay.
With very few exceptions, it's safe for a mom who's sick to breastfeed her baby. Moms and babies are going to be in close proximity, so it's actually an excellent opportunity for mom to pass those valuable antibodies through her breast milk to the baby to strengthen their immune system.
Cool. So do you guys offer outpatient lactation services for moms that are having breastfeeding problems once they've gone home from the hospital, or is it just while they're here?
We offer services here in the hospital. We have 2 lactation consultants on staff here.
Oh, cool.
And we do ongoing breastfeeding training with our staff nurses as well. So there's somebody here to help you around the clock. In addition, if you go home and you're struggling, I really encourage you to reach out and give us a phone call. And if there's anything we can't help with over the phone, we can schedule a one-on-one outpatient visit for you here at the hospital.
So the lactation help doesn't just end when you go home. You can always come back and get help, or if you have a quick question, just call one of you guys on the phone.
You can call us anytime, and if we can't help over the phone, we will invite you to come in and work with you here in the hospital.
That's awesome.
Hey, I'm headed to the NICU. Do you want to come?
What? You guys have a NICU? Yes.
Yeah. It's right this way.
Awesome.
Bye, Brenda.
Bye. Thank you. So, yeah, that's right. Spotsy Regional Hospital does have a NICU. Let's see who's here. Oh, hey, it's Dr. Kablawi.
Hi.
Hey, what are you doing here?
So I'm one of the neonatologists here at Spotsy.
Okay, how many are there?
There's 4 of us that are core neonatologists here, and then we have a few part-timers that help out as well.
Really cool. So, okay, what is a neonatologist and a NICU?
A neonatologist is essentially a newborn specialist, so we all did our training in pediatrics, and then we spent 3 extra years doing subspecialty training in neonatology. So all of us are board certified in both pediatrics as well as neonatology. A NICU is essentially a ward for sick babies, so we take care of preemies. At this NICU, we take care of babies who are born at 28 weeks or older, or 1,000 grams and bigger.
Okay. So, what are the services that neonatology offers here at Spotsy Regional?
So we have a neonatologist in-house 24/7 here because babies are born any time of day and can have problems any time of day as well. Neonatologists here cover any high-risk delivery, so C-sections or any vaginal delivery that can have a complication. So we help take care of the babies over on the labor and delivery side, and then we staff the NICU as well, and we take care of the babies over here.
So, what makes Spotsylvania Regional Hospitals and Newborn Services so special?
I think what makes it the most special as a provider as well as for the patients is how much we focus on family-centered care. We try to prioritize every patient's belief systems and values. We try to incorporate their birth plan as best as we can, as long as it's safe for baby and mommy. And in the unfortunate incident that a baby may have some sort of a complication, we do everything we can to keep baby in the room with mom because we really don't like to separate baby and mommy.
I love that.
But when we have to and the baby has to come to the NICU, we do everything we can to help support the bonding process. For moms who are breastfeeding, we provide them a room here at the hospital after they've been discharged for a week to help establish their milk supply in that bonding period.
That's awesome. Well, great. Well, thank you for answering my questions.
Sure,
I'm
no
going to
problem.
finish my tour here. Oh, hey, Lisa.
Hi.
Hey, guys. Lisa is the director here at Spotsy Regional Medical Center.
Hi. Nice to see you.
Well, I'm glad I ran into you because I actually have a couple of questions.
Okay.
So, I guess my first question is, what is an LDRP?
So an LDRP are the type of rooms that we have here at Spotsy.
Okay.
So it is your labor room, your delivery room, your recovery, and your postpartum room. So once you are admitted into one of our rooms, you stay there and you obviously labor, delivery, recover, and stay in your postpartum room after you've had your baby. And the great thing about that is often your labor nurse is also your postpartum nurse your next day. So it's a really great concept to be family centered.
I love that. Well, let's keep walking.
Okay.
So I guess my next question is going to be, can you try to labor here at Spotsylvania Regional if you've had a C-section? In other words, can you try for a VBAC?
Absolutely. So if you and your physician have decided through your history and your plan of care that you would like to have a trial of labor after a cesarean section, we are here to support that. The nurses are here to support you in that goal. The physician, your doctor, will stay in the hospital while you're laboring. The anesthesiologists are here in case you did need an epidural, or if you ended up needing that C-section, they're here and ready for you.
Spoiler alert, I had a VBAC here at Spotsylvania Regional. They're
And
really
you were
awesome.
successful.
I was very
Yay!
successful.
Yes, great support here.
It really was an awesome experience. Last question, real quick. Do you guys have a nursery?
We do. So a lot of people think with an LDRP, that one room concept, that there's not a nursery, but there actually is. If you needed a rest, a nap, maybe you did have a C-section and your support person has had to leave for whatever reason and you're not up and moving about yet, of course the baby can go to the nursery and there's a nurse there to care for your baby. Or again, if you need a nap and need that break.
Okay, so the baby doesn't have to stay in the room at all times. If you need a break, there is a really safe, awesome nursery here at Spotsylvania Regional.
Exactly.
So it's kind of best of both worlds.
Yeah, we certainly support being in the room the majority of your stay for bonding, breastfeeding support, but there is a place to go.
Awesome. Well, thanks for walking me on my tour.
Sure. Nice to see you.
See you too. All right, guys. This is great. Oh, Who do we have here?
Hi, Brenda.
Hey guys, this is Amy Frederick. She is a midwife in the area, the midwife here at Spotsylvania Regional, and my midwife.
Yay!
So, Amy, I have a few questions for you. You ready?
Yes, I'm ready.
Okay, what is a midwife?
So, a midwife is a registered nurse who's had some advanced training in midwifery, has gone to an accredited midwifery school training program, and then has taken a national certifying exam. So basically, we're independent healthcare practitioners, sort of mirroring a nurse practitioner. We do care for women from teenage years the whole way through to postmenopausal care. So that would mean birth control, annual well woman exams, STD testing, of course, care during your pregnancy, and then, like I said, care even after you're done having babies in those years where you're menopausal.
So this is, I think, where some people get confused and what I totally didn't know. So midwifery is not just for when you're pregnant or wanting to get pregnant.
Correct.
Or postpartum. It is whole life care for a woman.
Exactly.
That's cool. So next question. Does having a midwife with me during my birth mean that I cannot have pain medication or an epidural? Does having a midwife or even a doula mean you have to go natural all the way?
That is a huge myth and a big misconception, I think, among women, that if you choose to have a midwife with you during your pregnancy, that means you have to be natural or that you have to deliver at home. Being a certified nurse midwife, I can do births either in the hospital, in a birth center, or at home. I choose to work in a hospital. That's just personal preference for me. And while you're here in the hospital, what I really want you to have is the birth that you've planned. Now, if you've envisioned a natural birth, I really want to help you work together with a team to make that possible. If you want to have a hospital birth and the second you walk in the door you want some pain medication, that is completely fine, and we'll work together to try and get you the birth that you want.
Spoiler alert, I had a VBAC and Amy was my midwife, and I've totally had epidurals with all three of my children.
Spoiler alert, I've had epidurals with all three of my children.
So she's definitely epidural friendly.
Yes.
Okay, so my last question is for the community and for our pregnant mamas out there. It's been announced that a couple of our local midwives are leaving Fredericksburg. So what does that mean for pregnant mamas in the area that want services of a midwife? And what does that mean for the community?
Well, that's an opportunity for me to let you know that we are here. My office that I work out of is Advanced Care for Women. The provider that I work with, Brian Josephs, owns the practice, so it's him and I in that practice. We'll be here to provide services for any women that are in need of midwifery services. Our office is attached to the hospital in the Pagonia Medical Building, and I believe, Brenda, you're going to put some contact information down so that if you need care, you can get a hold of us. And I feel like delivering it in the hospital and being here at Spotsy, we have the best of both worlds, because not only if you're choosing a midwife, do you have a little bit more of that holistic care, more personal, a little bit more time, a little bit more one-on-one, but you also have the consultation and backup of an OBGYN physician who is going to support your wishes in birth, and hopefully we'll work as a team to have a great baby.
Did have a question about that.
Sure.
So that kind of brings me to this in a way. So if I have a midwife, I can also then have an OB, or can I have just a midwife, or just how does all of that work?
So like I said, a midwife is actually an independent practitioner, but as I said, I choose to work with a physician, and I think, like we said, that's the best of both worlds, because
right, absolutely.
A midwife their philosophy tends to be a little bit more personal, a little bit more holistic, in that we take into mind spiritual aspects of women, what's going on with their family, and what might be going on in their life right now. Is this their first baby and they're just super anxious, or is it their 9th baby and they're welcoming a new baby into this big home? Then you have a physician who is there, and kind of the more medical model is kind of treats pregnancy as is there symptoms, is there something wrong, can I fix something? Which, yes, that happens sometimes, not always, but if that does happen, you have the great backup of a physician. If you would need surgery, or if something where you become sick with your pregnancy, then you have that physician backup, which is great. So I think if you choose a midwife in me, you're going to have also the backup of a doctor whose philosophy is the same. So that's probably a great combination. If you were to just choose a midwife, I feel like if it's someone on your own or that delivers outside of the hospital, then just be very careful in asking questions to make sure that you're getting the proper safe care that you want for you and your
Absolutely.
baby.
Never be afraid to ask questions, guys.
Yes.
Always ask questions. So I think that's it. I think that's our tour. Gosh, thanks, Amy, for being here, and everybody here at Spotsylvania Regional. Like I mentioned a few times before, if you have questions or if you need information, I'm putting all the information for contact info in the comment section below this. Thanks, guys.